Perioperative analgesic protocol for lower limb arthroplasty operation. Lower limb arthroplasty operations include total knee arthroplasty, total hip arthroplasty, partial arthroplasty of knee or hip joint, and ankle arthroplasty. If the patient receives intrathecal diamorphine, then this protocol should not be used. Tablet pregabalin 100 mg, paracetamol 1 gram, naproxen 500 mg, lansoprazole 15 mg, and oxycodone 10 mg should be given per orally as a pre-medication in the morning of day of operation. If one or more of the following is present, then the reduced dose protocol should be used. Like the renal impairment, when the eGFR less than 30 ml per minute, age more than 75 years, and history of obstructive sleep apnea, then the reduced dose protocol should be used. Here we use the pregabalin and the oxycodone in the half of the normal standard dose protocol. Other drugs like the paracetamol, naproxen, and the lansoprazole should be given at the usual dose. So the pregabalin we use in the standard protocol is the 100 mg. So here in this cases we give the 50 mg, and the oxycodone, which is given as a 10 mg in the standard protocol, we should give 5 mg in the reduced dose protocol. Anesthesia, we can do the operation under the spinal anesthesia or under general anesthesia. Antiemetic like the dexamethasone 6.6 mg IV and or ondansetron 4 mg IV should be given as an antiemetic. Tranexamic acid 10 to 20 mg per kg, maximum 2.5 gram. If the patient is undergoing total knee replacement, then that should be given prior to the release of the tourniquet, and in case of the total hip replacement surgery, injection tranexamic acid should be given at the time of just before the incision. If the patient is undergoing spinal anesthesia, then either propofol target control infusion up to the dose of 2.5 microgram per ml should be given. Otherwise, we can also give ketamine 5 mg each bolus dose repeated up to 0.5 mg per kg in total. If the patient is undergoing general anesthesia, then adductor canal block or the femoral nerve block should be used. Intra-articular administration by surgeon, 100 ml to 150 ml of 0.2% ropivacaine or 0.125% levobupivacaine can be used. Some adjuncts can also be used like the adrenaline 1:1000 dilution, NSAIDs or opioids along with this local anesthetics. For the post-operative analgesia at the day 0, that means the first post-operative night, we'll give oxycodone 20 mg per oral, pregabalin 75 mg per oral, paracetamol 1 gram IV infusion, naproxen 500 mg per oral, lactulose 10 ml per oral. If the patient is in the reduced dose, as we stated before, then the oxycodone dose and the pregabalin dose should be changed. Oxycodone we can give 10 mg per oral, and pregabalin we can give 25 mg per oral. In the next day, the dose of the oxycodone is 20 mg per oral, pregabalin 75 mg BD per oral, paracetamol 1 gram IV QDS, naproxen 500 mg per oral BD, lactulose 10 ml per oral BD, and lansoprazole 15 mg per oral OD. In case of reduced dose, only the oxycodone and the pregabalin will change. Here we can prescribe oxycodone as 10 mg per oral and pregabalin 25 mg per oral BD. The next day, that means in the second postoperative day, oxycodone dose should be half. That means 10 mg per oral. Pregabalin same as before, like the 75 mg per oral BD, paracetamol 1 gram per oral QDS, naproxen as before 500 mg per oral BD, lactulose and the lansoprazole as previously mentioned as the same 10 mg per oral BD for lactulose and 15 mg per oral OD for lansoprazole. For the reduced dose protocol, oxycodone dose is 5 mg per oral OD and pregabalin 25 mg per oral BD. Other drugs will be same as the standard protocol. The third postoperative day, oxycodone should be given 5 mg per oral. Then the dose will be replaced with codeine phosphate 30 to 60 mg per oral QDS. That would be the same for the reduced dose protocol also. For pregabalin, will continue as it is before, like the 75 mg per oral BD, and for the reduced dose protocol, that is the 25 mg per oral BD. Paracetamol, naproxen, lactulose and the lansoprazole is in the same dose, just like the previous day. Paracetamol 1 gram per oral QDS, naproxen 500 mg per oral BD, lactulose 10 ml per oral BD and lansoprazole 15 mg per oral OD. On discharge, pregabalin should be given 75 mg BD up to the 10th postoperative day, and for the reduced dose protocol, this dose would be 25 mg BD up to the 10th postoperative day. Paracetamol will continue up to the 7th postoperative day in the dose of 1 gram per oral QDS, codeine phosphate at the dose of 30 to 60 mg per oral QDS, naproxen 500 mg per oral BD, lansoprazole 15 mg per oral OD up to the 14th postoperative day, and lactulose 10 ml per operative BD for another 4 to 5 days. Non-pharmacological measures like the early physiotherapy, early mobilization and cooling device such as the cryo cuff can be used.